everyone, I'm going to demonstrate how to prime your IV tubing. For today, I'm going to have my supplies hang up on this rack because I do not have a table that is waist height or above. So you start by washing your hands, and you want to follow the 6 rights of medication administration and make sure that everything matches the doctor's orders. So this solution would come in a sterile bag, and you want to make sure that you have the correct solution, check the expiry date, make sure they have the right size bag, make sure the solution is not discolored, there's no floaty bits, and you want to make sure that there is no precipitation, it's not leaking, so you could give it a squeeze, make sure that there's no leakage. And for the tubing, you want to double check that you have the correct tubing, that you have the correct chamber size, and you want to make sure that the package that comes in is intact and that has these 2 end caps because you want to keep this sterile, and it seems to have all of the above. So I'm going to start by removing this cap, and turn this up, removing this cap, inserting it. I want to make sure that you insert all the way so it doesn't leak. And you want to make sure that your clamp is locked. Lift it upside down, and you're just going to squeeze the chamber to make sure that the solution falls in there to 1/2, 2/3. Alright, now it is. So I'm going to open up my clamp, and I'm going to let the solution flow just right before this Y port. And now I'm just going to tighten it, and I'm going to flick it to remove all air bubbles. Alright, and now I'm going to release the clamp, and I'm going to let the solution flow all the way just before this end. Right, so I tightened it up, and the solution is just before this end. And so now I'm going to make sure that there's no other air bubbles. So you're just going to strum this and pull it tight. When I'm strumming this, I'm holding it upwards to let gravity help me pull the bubbles upwards. Alright. Now I'm going to say that this is a sterile bag, and I'm going to remove this cap. And I'm going to open up the cap, and I'm going to let the solution prime all the way out and let some of the solution flow out. There, now I'm closing it. Now I have everything primed. Now it's ready to insert into the patient's catheter. And before inserting it, I want to check the patient's skin to make sure that it's not red, it's not swollen, and it's not tender. Of course, you would inform the patient of who you are, and that you're a student nurse, and tell them what you're going to be doing, and you pull the curtains for privacy, and you would already have clean hands, and you'd be have sterile products still. And after you've checked it, you clean all the ports. So if you use this or to to put in another medication, you use an alcoholic wipe in a circular motion 3 times, make sure that it is clean. And after you've inserted it, you would label your solution and tubing. You would put your initials and you put the date, and you would put what solution it is and the drip rate. Alright, thanks everyone.